Welcome back, everybody. I hope you've all filled up, but not enough not to pay attention for the next half of the day. It's always the challenging part of the agenda. So thank you very much for coming back to us. So this section, I'm really pleased to facilitate. It's one that's very close to my heart. Waste, we've heard a lot about emissions, carbon emissions, energy, how we might solve energy. Now it's sort of talking about the waste side of things. And this is the one I get asked a lot about. So my name is Simone Ryder. I am the Director of the Office of Hospital Sustainability within Queensland Health. And when we go out to our hospitals, we get asked about this all the time, about waste. And it's the thing that clinicians, our staff, see on a daily basis. And so I'm very pleased to be part of or facilitating this next part of the discussion. So also within our abilities, how we use our products and the proliferation of single-use items and the just often of items that just don't get used but might be thrown away. So a lot of the speakers that you'll hear about this afternoon are working in this space around trying to reduce our single use and doing something different, diverting waste into other areas. So I will jump in, and the first speaker we have this afternoon, who is online for us this afternoon, is Stephanie Canaro. Stephanie is an accredited practicing dietitian, currently working in a novel role as a sustainable food systems dietitian at the Eastern Health in Melbourne. She's in her final stages of a PhD at Monash University's Department of Nutrition, Dietetics and Food. Her PhD explores environmental sustainability of hospital food services using qualitative research methods to understand the barriers and the enablers both locally and in exemplar hospitals around the world. So I'll hand you over to Stephanie.
Thank you very much. Good afternoon, everyone. Yes, as Simone mentioned, my name's Stephanie. I'm a PhD candidate at Monash University, and my research explores environmental sustainability of hospital food services. So in the first part of this presentation, I'll give an overview of healthcare's food sustainability challenges based on some of my research and the literature. And then I'll present a case study on a novel role we established for a sustainable food systems dietitian here at Eastern Health in Victoria. I'd also like to acknowledge and pay my respects to the traditional owners of the lands I'm speaking to from today, the Bunurong people, and also just acknowledge that First Nations people have been stewards for a truly sustainable food system, which we have a lot to learn from. So as we know, hospitals provide 3 meals every day to all of their patients, as well as snacks and drinks, and this requires significant inputs to prepare the meals such as energy, water, land and labour, and also produces outputs such as food and other related wastes. And all of these can have a significant impact on the environment, especially when we consider all of the stages of the food supply chain, from how food is produced, where it's transported, distributed, sent to either a central production kitchen where meals are produced in bulk and sent to hospitals, or if it goes directly to a hospital and they cook meals fresh on site. And then also what the menus actually consist of, whether it's focused on animal products or whether it's more of a plant-based options. Something that we found in the systematic review that we did on this was that plate waste can be really significant, often ranging between 6 and 42% food wasted on a patient's plate. And in terms of the whole of hospital waste, food can make up between 20 and 30%. Obviously, that has associated economic impacts and also carbon emissions, especially when something else that we found in the systematic review was that the majority of that food being sent to landfill is still the most common destination for food waste. So not just is food going to waste a missed opportunity for nutrition, but also a waste of all of the resources that go into preparing patient meals all across this food supply chain. So we know that food services need to change, but there are many challenges that hospitals experience. So here are some barriers that staff reported who work across the food supply chain from some interviews that I did. So firstly, competing priorities was a big one. Food services need to manage food safety and nutrition standards, and they're also under very tight timing and funding constraints. Infection control requirements was another one, especially being a barrier to reusing food, especially packaged food options that go to a patient and come back completely untouched. There was the notion that sustainability initiatives in the hospital overall tends to focus on more of the big ticket items such as energy and water usage rather than food. And although staff agreed that change does need to happen in food service, they thought there was a lack of time, not enough dedicated staffing, and they weren't really confident that they had the knowledge or training on what they should do. Also perceived there to be lack of policy to support sustainable food services, and the policy that existed were contradictory to sustainability and was really quite a barrier. So what does sustainable food services actually look like, and what are we working towards? These are some examples from some exemplar hospitals I interviewed globally, and these hospitals had received awards and were featured in webinars and reports. So they were purchasing food locally, choosing organic ingredients. There was one hospital in Canada that was serving traditional Indigenous foods, and they engaged with their Indigenous elders to prepare those in a culturally safe way. They also had gardens on site, were cooking meals fresh on site. So they had bakers and butchers. They were steering clear of any single-use plastics. A lot of them had the room service models, and other ones had different strategies to really reduce the time between meal ordering and delivery, which would result in much higher patient satisfaction and reduced food waste. There were a few hospitals that had entirely plant-based menus, and many others had really well thought out plant-based menu options. And there was one hospital that even based their menu off the Eat Lancet report, which defines what is a healthy diet from a sustainable food system within planetary health boundaries. And lastly, food waste. So they were reusing as much as they can more of the packaged food items. They were composting it on site, or they were sending it off site to go to farms, and even dehydrating food waste and sending it off to turn it into electricity. So what drove change in these hospitals? It was really the values. So they drew upon the values of the hospital to really drive change and get leadership support. So in many of these hospitals, they really valued serving healthy and high quality food to patients to support their recovery. For some hospitals, it was around they knew that they needed to make big change to reduce their environmental footprint. So food was one of these. And for others, they did a food waste audit, found out that they were wasting a lot of food, and they saw sustainability as a way to improve satisfaction and reduce their food waste and costs. And then just briefly in terms of enablers that helped them to create the changes, there were, in all of the hospitals, there was really dedicated individuals who really valued this work, and they drove the change, but they were also supported by having students and working groups to get some of the work done. It was really important that they had supportive leadership, and they came up with their own internal policy documents to really create that shared agenda and embed practice. And then these hospitals were also part of sustainability networks such as Global Green and Healthy Hospitals, and they really made an effort to learn from and work with other hospitals, showing a lot of leadership in this space. And so with all these factors, they were able to have much success in those sustainable practices that I just showed in the previous slide, but they were also able to influence government policy, really inspire other hospitals to do the same. And they use what they were doing as a way to educate the hospital community around what is sustainable food. So that was a brief overview of the environmental impacts of food services, some of the challenges hospitals experience, what we're actually trying to work towards when we talk about sustainable food services, and some of the drivers for change. So now this part of the presentation will now focus on a solution to one of those barriers I mentioned around a lack of dedicated staffing. So this part of the presentation will be about how a sustainable food systems dietitian can help degreened hospitals. So a bit of background about the role of a dietitian in a hospital is that typically clinical dietitians are responsible for assessing nutritional needs of a patient and planning therapeutic diets to support patient recovery. Food service dietitians are also often employed by hospitals, and they ensure a nutritious menu and food supply for patients. In recent years, Dietitians Australia released a statement saying, defining the role of dietitians in environmental sustainability. And they included that, yes, definitely clinical dietitians should be talking to patients about sustainable and healthy diets. And food service dietitians can also undertake different sustainability initiatives, such as looking at food waste minimisation and food procurement. So we definitely have a role to play. So what we did was established a new sustainable food systems dietitian role. We did this at Eastern Health, which is a large metropolitan multi-site public health service in Victoria. And the primary aim of the role was to embed environmental sustainability within food services at the health service. And I've been lucky to work in this role since January. So it was a 1 day a week position. It was funded by a university partner as part of a collaborative teaching, research, service delivery arrangement that was ongoing. The role reported to the dietetics department, but also had involvement with the sustainability committee and the food service leadership committee. And when we were in the planning stages for this role, to figure out the scope of it, we really conceptualized it based off a published framework by CAGTO. So I'll go through this framework, but the aim of the framework is to formulate multi-dimensional and multi-level solutions to solve a complex nutrition problem. So I'll go through some examples of some of the strategies that we thought fit within the scope of the role based on this framework that we identified. So the first one was about strengthening individual knowledge and skills. So that's the knowledge of our patients. So this would be around providing education to patients on healthy and sustainable diets, and other strategies such as including sustainability metrics on the food provided, such as on menu cards. The next one was around promoting community engagement and education. So this could be doing promotional days and roadshows and showcases. Activating intermediaries and service providers. So this would be engaging with dietitians, upskilling them, as well as food services, and doing sustainability projects with them. Facilitating partnerships. So this could be around building a community of practice with other dietitians and engaging with member organisations such as GGHH. Aligning organisational policies. So looking at what policies we currently have and potential areas for improvement. Looking at our current systems and settings and looking at ways to improve them. So that could be doing local food audits and food waste audits. And then lastly, building relationships with policymakers and contributing to stakeholder input on policy development and advocacy. So some achievements so far in this role, and I will preface it that there have been many challenges this year within the health service, in that we had an internal emergency at the start of the year, which meant our whole system was down for quite a few months. And then COVID demand meant that a lot of staff's focus turned to obviously patient care. But it was really beneficial in having this dedicated role, in that it could still focus on doing sustainable food work. But obviously engagement from other departments had to be limited at some times of the year. So firstly, what we did was a needs assessment of dietitians' interest in learning about sustainability. So this was really valuable information and something that we will be able to use to put together a training resource for dietitians to talk to patients about sustainable and healthy diets, and also put together a resource that dietitians can go through with patients. We also did 2 campaigns, so one for Stop Food Waste Day and World Food Day. And this was around increasing the hospital community's knowledge of the work being done so far in food waste, but then also in educating around what is sustainable food and what does it look like to have a sustainable diet. We did a food waste workshop for dietetic students for them to think about the system overall and what they could contribute in their future work and also on placement to reduce food waste. And we had really positive feedback from the students in that they were really interested in learning more about environmental sustainability in the future. We also did a student placement project where they scoped out our organisational food policies that looked at where we address sustainability and also came up with some recommendations for change. So that will be, those findings will be really useful in facilitating conversations within the hospital to look at potential practice and policy change to support sustainable food delivery. We did some very preliminary work into conducting a local food audit, so hoping to start that up next year. put together a grant proposal to continue some work done previously at the health service, looking into the safety of reusing unopened packaged food items. And we established a really great working relationship with the food services department, and we were able to do two food waste audits and satisfaction audits. And we also involved clinical dietetic students, and that was really great learning opportunity for the students, but also provided us with hands to be able to do the audit. So that was, yeah, a great opportunity. And then lastly, we contributed to stakeholder feedback on a new state government policy for local food procurement. And this role has been presented at several conferences to really inspire other dietitians in other hospitals to think about how they could better embed sustainability into their current practice. So to conclude, all hospitals really must consider their current capacity and rethink their approach to delivering sustainable food. There's an opportunity that several of the elements of the framework I discussed could be embedded into existing clinical and food service roles. However, when there are many competing priorities for health services, there's a real need to have a dedicated role for someone to provide that leadership and coordination and strategic guidance to drive this work to ensure that it gets done. And this novel role also demonstrates how other allied health professionals could reimagine their field so that we can all work towards sustainable healthcare. Thank you. Here's my email, so please feel free to reach out if you'd like a copy of any of those publications that I referred to. I'm also on Twitter, and stay tuned for a publication on this novel role as well.
Great, thanks very much, Stephanie. It's nice to see you've got some action, especially around a role. I think that's something we're hearing a lot about today, is that just getting dedicated people to enact the change has been quite a hurdle. So congratulations on that. So thank you. Our next presentation today is Dr. Angela Giannoni. Dr. Giannoni is a nutrition and a research development lead at Doctors for Nutrition. Angela's PhD was awarded in 2018 for her research examining long-term effect of low carbohydrate diets on the gut microbiome. Angela is passionate about the environmental impact of dietary choices and the massive environmental and health gains that can be made from switching to plant-based diets. Angela is currently working on a large project modelling the economic, environmental and health gains applicable from moving Australia's dietary patterns towards a whole food plant-based diet. Angela is a fitness addict, avid swimmer, volunteer lifeguard, mum of 3 boys, and proudly powered by plants. So I'd like to hand over to you, Dr. Angela. Thank you.
Thank you very much. And thank you, Stephanie, for your presentation just before mine. I think mine actually ties in very nicely with your work that you're doing. So my name's Angela. I work at Doctors for Nutrition. I'm the Nutrition and Research Development Lead. Doctors for Nutrition is a health promotion charity. We target healthcare practitioners and provide a whole host of evidence-based nutrition solutions for your practice. And we also do a lot of advocacy work promoting more plants for increased health outcomes. So while our work predominantly is around health outcomes, we are also, ties in very nicely with the environment, because we all know plants are a bit of a win-win. So this work is part of a larger project actually based on the Australian public, not so much on food service in the hospital setting, but we're going to link the two together today as part of this presentation. So we know food production and consumption comprises around 35% of all greenhouse gas emissions, and animal-based foods comprise over half of this amount. So it's pretty important that we all start to do something to reduce our animal food consumption and eat more plants. Australia is one of the worst offenders for our emissions equivalents from food production and consumption. You can see that little graph there. We're exceeding our planetary boundaries for food by a long way. If we continue at the current rate of production and consumption, we actually need 6.83 Earths to sustain our food supply going forward, which quite clearly is not sustainable. It's pretty clear that, and there's more and more evidence coming out every day now around the health benefits of plant-based or predominantly plant-based dietary patterns. And you can see from this graph that the foods which are considered the most health promoting are actually the ones with the lowest environmental impact. So we heavily promote your fruits and vegetables, whole grains, nuts and legumes as the basis for a healthy diet. And just coincidentally, that also has a very, very low environmental footprint. So just following on from Stephanie's presentation and highlighting some of the challenges with implementation of sustainable food in the healthcare sector, some research recently has highlighted that there's some barriers to implementing this, and some of that includes a lack of knowledge and a lack of confidence to advocate and implement. So hopefully those of you that are healthcare practitioners here today and working in the healthcare sector can gain a bit of that knowledge and perhaps even a bit of that confidence to get in and advocate for your healthcare or food supply within your healthcare to become more sustainable and head towards a more plant-based friendly options. There's a perception amongst the general public that plant-based diets can be seen as somewhat elitist or expensive. And I guess in the past there has been research which has indicated that. However, if you base your diet around very minimally processed plant foods, in theory, it shouldn't cost any more at all. And so part of the research that we wanted to do was to have a look at just that and see whether basing your diet on these types of minimally processed foods, what does that cost look like? And is that appropriate across different socioeconomic areas in Australia? And then what are the associated greenhouse gas implications for that type of dietary pattern in an Australian context? And if we apply that type of diet across, a broad spectrum of the population, what sort of savings could we expect to make from, the health spending, but also in terms of reduction in rates of disability and ill health in Australians? We have seen some research out this year that has shown that healthy diets actually cost no more than what people are currently eating. And we know that most Australians spend a lot of their food budget on discretionary food choices, which are not essential for human health. So the aim of this project, and I should point out that we haven't, this project is not aimed at food service in a hospital setting, it's aimed at the general public. So we're going to be sort of talking about extrapolating some of the findings and how it might benefit the food service provision in, say, a hospital setting. But we wanted to investigate the nutrient adequacy and cost of a plant-based diet in comparison to one which a typical Australian is currently consuming. So we've used some previous publications on typical Australian diets from over the last 5 to 10 years. These dietary patterns are based on a family of 4 with 2 adults and 2 children. For the purposes of our investigations, we have just based our calculation on the adult proportion of the diet. We've used the same energy intakes as the adults provided in these publications. So we have met the same targets, and we have met all the nutrient reference values as the other publications have also done. So we structured a 3-day plant-based meal plan which hit all those targets, and then these plans were costed up across supermarkets in Perth. We will also be basing our costing around supermarkets in all capital cities and also in a sample of rural areas to get a cost or an indicative cost of how the price might vary across different socioeconomic and geographical areas in Australia. So the typical Australian diet or a typical Australian food basket does not meet the recommendations for fruit and vegetable consumption. We know that most Australians don't eat enough fruits and vegetables. So the typical Australian diet basket that we looked at provided only 1.7 serves of fruit and 3.8 serves of vegetables. 3.82 serves of fruit on a plant-based diet compared to 3 serves of veggies on a typical Australian diet and 8 serves on a plant-based diet. So you can see that structuring or changing, removing those animal foods sort of automatically means by concentration, you're adding more plant-based foods to your diet and you're more likely to hit those fruit and vegetable targets. Dietary fibre is a lot higher in the plant-based diet and saturated fat is a lot lower. So how did the cost come out? Now, keep in mind, these are not based in a food service setting. You can see the cost is actually very similar. Now, I'd like to just point out that the protein foods here are for quite cheap cuts of meat. In a food service setting where you need to hit the Australian dietary guidelines, you'd be using the leaner cuts of meat, which would increase the cost. So you can see straight away if you switch to some more plant-based foods and with your, provision or procurement from wholesalers, there are quite significant cost savings which could be made from switching to a more plant-based option. Removing discretionary items, obviously food service in hospital settings do not provide a lot of discretionary options, but swapping these for some more plant-based options is also likely to increase cost savings. And also from a food service perspective, something to consider, and in line with Stephanie's presentation around food waste and the whole food system within that healthcare setting, plant-based proteins carry a much lower food safety risk. They have a longer shelf life and you can purchase them in bulk, which would, translate to more significant cost savings. We're also going to be increasing the nutrient quality of the diet, which, although it's outside the scope of this project, is likely to have effects on recovery time also. So in summary, plant-based diets are a win with a much lower environmental footprint. We need to have bold leadership here to encourage leaders to take on this challenge of having climate-friendly and plant-based catering policies. And we need to consider the health benefits that come along with the plant-based diet. It's not just a win for the environment and for perhaps cost savings. There's, significant flow-on effects for health as well. Thank you very much. Please connect with us at Doctors for Nutrition if you would like some further information. We would love to hear from you.
Great, thank you, Dr. Janoni. It's great to see some great evidence-based data coming through that we can use to help sell these not new ideas, but a different way of working. So it's nice to see some of that data. And just personally, I'm very happy that chocolate wasn't mentioned in that at all. So I still consider that a plant-based diet. So thank you very much for your time today. Next up on the agenda is Cleanaway. So Cleanaway are a major sponsor for today's event. The next two speakers sorry, my apologies. Major healthcare supplier, Queensland Health uses them as well, and are committed to improving sustainability as we all work together to protect the environment. I would like to hand over to Hugo Paris and Oscar, I'm going to pronounce this incorrectly, apologies, Lazarowski, from Cleanaway. Thank you.
Okay. Good afternoon and thanks for the opportunity to speak today at this forum on a subject matter that I'm certainly passionate about, sustainability, recycling and resource recovery. My name's Hugo Paris and I'm Cleanaway's Regional Manager for Recycling, Organics Depackaging and the Container Refund Scheme. I've been involved in the recycling industry now for around 28 years and I'm currently responsible for the management of a number of waste and recycling facilities throughout southeast Queensland. As we know, recent changes in government policy, including rolling waste export bans, China national sword, and increased scrutiny of the waste and recycling industry in general, has created greater uncertainty for all stakeholders. In essence, it's created a gap between community and customer requirement and business capability. In Queensland and nationally, we currently don't have access to adequate infrastructure to process many of the recovered recyclables that have previously been accepted. These vast array of recyclables and the way in which they are presented impacts us on many levels, as demonstrated in this particular slide. The recycling industry, as well as many others, rely on economies of scale and the presentation of clean, easily recoverable materials to help drive cost-effective and efficient solutions. As an example, Cleanaway has previously offered what we called our Harvest service. Harvest allowed for high volume, low weight materials such as KinGuard, LDPE and polystyrene, previously destined for landfill, to be placed in the same packer or bin as cardboard. The material was required to be presented in a clear plastic bag and free from contamination. Unfortunately, this did not consistently occur, which is forced to rethink on how we can best satisfy market need, both for the generator and for the end market processor. In light of these changes, Cleanaway has introduced a trial in Southeast Queensland of a hybrid version of a standard commingled service. We've called this new trial offering advanced recycling. The benefit of this service is that the types of products that are accepted have existing and robust end market recycling options. In other words, if you place the approved materials in the correct bin, then they can and will be recovered, recycled and
Hugo, I think we lost your voice.
As you can see from the next few slides, on this table alone, there are over 100 items recently presented by the healthcare sector inquiring as to a solution. Most of these items are technically recyclable, but at present, due to the low volumes of each material stream, mixed polymers stuck together, glues, labels, and the sheer variety of product presented, the recovery of every single item is not currently possible. We must start with high volume materials and keep the messaging simple and grow our capability from there. Contamination is still the most critical factor in ensuring the long-term viability and sustainability of recycling. If contamination can be eliminated, it significantly reduces potential harm and exposure to our employees during the sorting process, increases throughput, reduces residual waste to landfill, and widens end market disposal alternatives. This will in turn drive greater investment in post-collection assets, including sorting, processing, and recycling infrastructure. Ultimately, this creates a recycling circular economy with long-term, sustainable, environmental, and commercial benefits. The healthcare sector has been a willing and valuable contributor to the diversion of many tonnes of recyclable materials from landfill. The exciting and pleasing part of this journey is that the health sector and Cleanaway have made significant progress in getting the fundamentals right. Some of those fundamentals are education and training. New starters that could be generators or handlers of waste and recycling should receive clear and adequate training. Cleanaway can tailor our Greenius online education program to help support the onboarding process in your organisation. Source segregation at site, clarity on what goes where and why. Appropriate signage, keep it simple, up to date, and make sure it aligns with your waste management goals. Site design and ergonomics. Allocate enough space at the point of generation and in designated waste and storage areas. Agree on a collection service frequency that is appropriate to the volumes that you generate, and right-size the type of bins to help incorporate them effectively into your site's waste management process. Making sure that the message is consistent. Stay informed and up to date. Consistent volumes. Longer-term contracts give businesses such as Cleanaway certainty, and this contributes to greater investment in long-term infrastructure projects. And the procurement process, where possible, look to purchase equipment and products with recyclable packaging that we know can be recovered and recycled. And last but not least, contamination. Continuously strive towards elimination. I think I've only got 5 minutes and I've probably used it, and I probably need to throw to Oscar now. But thank you very much for the opportunity to speak here today. And I look forward to questions being funneled back through our group, and we hope to answer them, everything you have, in due course. Thank you very much.
Thanks, Hugo. Hugo, are you able to drop your screen share there? Thank you. Perfect. Thank you everyone for having us. Hugo's already done all the introduction. I want to speak from a different tangent but complement what Hugo has already discussed. And that is that, we're all starting to recognise that we all need to do our bit. And ultimately the environment has no voice, and we speak for the environment, and ultimately we actually have the final say. And as we're sort of watching our understanding slowly evolve, we start seeing legislative changes, like the US have passed an environmental legislation which actually gives the environment a right. And it's a right like a person. So, i.e., you could be prosecuted for killing the environment. So, all these changes are right upon us right now, and that is effectively something that we need to be more and more aware about. This is sort of a really quick recap of what we do need to do more of in health, and that is that, and everywhere for that matter. Hugo sort of touched on, this notion of wishful recycling, right? Just because we throw something into a recycling bin, we expect that it's going to get recycled. And ultimately, we need to be, very, very optimistic, but we also need to be realists at the same time. So the War on Waste was a really good introduction at getting a good insight into the waste industry and what actually happens in the background. The other thing that we really need to do is start really thinking in life cycle assessments and net environmental benefit to the environment. And that is something that's really important. Outside of that, I think in healthcare, we all need to realise that we have a really big influential power. Like the decision of one individual, right, could potentially change, 580 odd thousand individuals, because that's how many healthcare practitioners there are. And there's over 400,000 nurses. When we're thinking about what's available right now in clinical and related waste, well, I think we need to sort of walk through sort of environmental compliance, which is a non-negotiable, the differentiated sort of waste treatment processes that are available, and some existing services that are already available, which are accessible to the broad market. And so environmental, I'll skip through because we're running out of a little bit of time, but we've got this notion that we're seeing much more less incineration within the clinical waste industry at a global level. And that is because, quite simply, incineration versus autoclaving is 2 to 3 times more taxing from a greenhouse emission point of view. And that's the reason why, over sort of 60, 70% of the total processing of clinical waste around the world is now done in autoclaving. So we still need to keep moving down that pathway where it's available and accessible. Outside of that, we know that there are good initiatives out there already where a reusable sharp system is effectively 84% better for the environment. There's a recent publication there from the NHS. And just big round numbers, it's about 2.1 tonne worth of plastic that's prevented in healthcare by using a reusable sharp system, and about 150 kilograms of cardboard per 100 beds. Outside of that, there's bagless clinical waste systems, which also produce, very good benefit for every sort of 1,240 litre mobile garbage bins. That's about 80 kilograms of single-use plastic that we're effectively preventing being initially manufactured and then disposed through a clinical waste stream. And to put those into perspective, as it stands currently, in the last 12 months, just those 2 products alone within the Australian healthcare services have prevented 1.3 million kilograms of plastic being produced, utilised, and sent to landfill, and about 118 kilograms of cardboard. And I think we can get lost in those numbers. So if we look at it in equivalence of the number of plastic bags, like shopping bags, which is a bit of a hot topic, it's the equivalent of 235 million shopping bags. So it is a significant number, and it's equivalent to about 75% of the total nurses in participating hospitals using a keeper bag. Now, if we look at coffee cups, it's sort of 400 odd million and 300 billion plastic straws. Thank you, everyone. Thank you for your time.
Thank you, Hugo and Oscar. I suppose probably the big thing for us as health staff is the contamination and how we might be able to help get those recycling and recovery rates up as well. So thank you very much for your time this afternoon. Next, I would like to introduce Ashley and Janie Morris, who we have worked with over the past year myself through the department. So I'm very pleased to have them here today in person as well. Ashley and Janie are the co-founders of Corio, a family-led business unlocking the value of the circular economy. As CEO and COO respectively, Ashley and Janie have made waves of impact since they've launched their first proactive and practical circular economy or circular experiment in 2017. Since then, they have been invited to share their views at the 2019 United Nations General Assembly. They've been appointed Associate Professors of the Circular Economy at Griffith University, and both are listed as CSR Top 100 Leaders in the World. Alongside their tight-knit team, Ashley and Janie work with companies like Rio Tinto, BHP, Lendlease, L'Oreal, Sustainability Victoria, Hydro Tasmania, and the City of Sydney to take the circular economy out of theory and put it into practice. So thank you very much.
Hi, everyone. So hello, everybody. Again, Simone. So I'm Janie Morris, the Chief Operating Officer of Corio.
And I'm Ashley Morris, the CEO of Corio.
Before we get started, I'd just like to take a moment to acknowledge the traditional owners of the land on which we meet, Yoa, which is hello in Turrbal. So it's Turrbal and Yagara people that we pay our deep respects to. We recognise it was Aboriginal and Torres Strait Islander, land and sea. It always was and always will be. So as Ash said, or not Ash, sorry, as Simone said, we are sisters and we're also best friends and the co-founders of a small circular economy company having a big impact globally. We are delighted to be here today to explore a more regenerative approach to the healthcare sector. Healthcare is vital, but the environmental impact is not.
So how can we deliver public health outcomes that don't cost us the health of our planet? Australia's healthcare sector accounts for 7% of our carbon emissions. Each year that equates to 35 million tonnes, the weight of 80,000 jumbo jets. Although hospitals make up the largest share of carbon emissions, the footprint is across the sector, from pharmaceutical production to service provision and facilities, the design of medical infrastructure, supply chains, and of course, waste disposal. A recent literature review came to the conclusion that half of the world's population is at risk from the health impacts of healthcare waste. This, my friends, is not an example of a healthy healthcare system, which of course is why we're all here today. A systemic problem requires a systems-based solution. Fortunately, the circular economic model is designed with systems change in mind. The big question is, how can we accelerate the transition to an economy that serves people and nature rather than one that we live and die in service of? We need to change the story to change the system. And let's start with today's front page story, the linear economy.
So our Take Make Waste linear economy is powered by an interconnection of three things, which I'm sure you'll recognise in the design of the healthcare sector. So first, fossil fuels, which provide cheap energy, mechanising mass production. Second, mass production is then motivated by low-cost credit, enabling large-scale purchasing power. And thirdly, this purchasing power creates economies of scale with such successful outcomes, our economic growth, that we turn a blind eye to the negative externalities, such as waste, deforestation, and environmental impact. So the Australian government spends $80 billion per annum on health. Australia's medical supply industry is worth $630 million, and Australia's medical waste industry is worth even more at $660 million per annum. And thanks to COVID, both are growing exponentially. The linear economy is powering an unhealthy healthcare system. In Australia, we might be resource rich, but we are not resourceful. We generate only $1.28 of output for every kilogram of material we consume, which is less than half of the OECD benchmark. Every year, we extract almost 90 billion tonnes of finite biomass, finite energy, metal and minerals from the earth, and we send almost everything we ever created or used to landfill or to incineration. Sorry to be so sobering, these facts are pretty startling, I know. Imagine this for a moment. If the Earth's entire history was squeezed into 1 year, humans have existed for only 37 minutes and already used up 1/3 of the Earth's natural resources in the last 0.2 seconds. In a traditional healthcare economy, we take resources from the environment, create healthcare solutions, treat patients in the hospital, and then throw away the equipment and burn the toxic waste. Why do we do that? Well, there are 4 primary reasons. First, healthcare has a single-use mindset. It is safer to throw medical equipment away after it has been used. The perception is that if we throw materials away, we reduce infection risk. The less we reuse, the safer. Second, it is difficult to reuse the equipment. It has to be collected, transported, cleaned, tested, and sterilized before reuse. It is much easier to throw a piece of equipment away and then grab another one. Third, equipment is so inexpensive and the necessary investment to reuse so high that it is financially unsound to even engage in reuse. And fourth, the industry that manufactures medical equipment has discovered that single use means the hospitals buy more. So by designing materials for a single use, the manufacturer maximizes its profit. It's really worth noting though, that these reasons are based on convenience and assumption rather than on curiosity and fact. So let's get curious.
So how can the circular economy turn this around? A circular economy asks us to think about value creation as being interconnected between environmental, social, and economic counterparts. One of the toughest realities to face is that our healthcare system is currently in a negative feedback loop. We know that healthcare saves lives. We know that lives rely on the natural world, but we also know that our natural world is being depleted in no small part by our healthcare system. To overcome this depletion, the circular economy can help create microeconomies needed to achieve the 3 key principles: to design out waste and pollution, to keep materials in circulation at their highest value for as long as possible, and to regenerate natural systems. The context of a circular economy requires us to understand that no material ever leaves our biosphere. They just change form depending on how they are valued. In a circular economy, value is seen as a transformation, not a transaction. In the circular economy, we use things rather than use them up. In a circular economy, waste is not a necessity, but a design flaw kept in play by lazy leadership. For example, a circular economy can abate 165 million tonnes of carbon pollution each year in Australia. That's the equivalent to every single person in Australia flying to New York and back again and there again every single year. At the same time, the circular economy globally is valued at a $4.5 trillion opportunity. And this year, PwC released a report highlighting that it is worth $2 trillion, I should say, for the Australian economy over the next 20 years. Circularity can help us address the 90% loss of our biodiversity through the extraction and production of resources. And moving to a circular economy will help us unlock the 91% of material value that is currently lost in our system today from single-use behaviour. So it sounds like it is a very promising opportunity, but the question still remains, how do we actually implement the circular economy to address these challenges in our healthcare system?
So something that you may not know is that prior to co-founding Choreo, I lived and worked as a remote area nurse in far north Queensland, in a very small Indigenous community on the east coast of Cape York called Lockhart River. So I know from firsthand experience that patient safety and quality care has to win above all else. I can tell you that I would drive hundreds of kilometres to collect trackers in 40-degree heat. I have stitched up domestic violent patients in the middle of the night, and I have sat and cried with my patients and their families when I have let them know that there's nothing more that we can do to save their relative. It's an incredibly heavy responsibility. And when our work involves saving lives, we naturally want to save them at all costs. Healthcare sits at the front line on so many social issues. Now the sector is being asked to take a leadership role on the environment as well. There is no silver bullet, but circular economy solutions are actionable across the myriad of challenges right now for any team member in any healthcare sector, in any role. It's the small moments that lead to the big movements.
And some hospitals and clinics, they're already on their journey to trying to do better and implement circularity. Forbes McGain is an anaesthetist who was fed up with all of the waste he saw in his current workplace at Western Health in Melbourne. He could not see the sense in throwing out the drug trays, the aesthetic breathing circuits, even the metal blades were discarded. All the paper products were thrown away, the plastic dishes, the drapes, the gowns. Dr. McGinn says this was pretty disheartening and spoke about the cognitive dissonance that it caused for him daily, but also his team and colleagues. So McGinn pushed for a waste audit and a financial analysis at his workplace. And after years of rhetoric that the single-use behaviour and practices were cheaper and safer in the long run, the audit proved otherwise. The hospital began bringing back some reusable items and is currently saving over $100,000 per year. They've now reused drug trays, they reuse blades to put the tubes down people's throats, they use reusable face masks, reusable breathing circuits. The hospital has now also started a PVC recycling scheme, recycling things like saline bags that they weren't previously either. So following this waste audit at Western Health, there is now a nationwide PVC dedicated recycling scheme, showing to what Janie just said, small movements can create big change. So Dr. McGinn's next mission is replacing single-use surgical gowns with ones that can be washed and reused. In line with the principles of circular economy, he stresses that reducing and reusing is far more important than recycling. It saves more money and it is a better outcome overall.
So this story demonstrates a great example of grassroots downstream systems change. But what happens if we innovate upstream? How can we change the design of the system itself from the outset? Leaders in the healthcare sector need to develop what we call a circular growth mindset, one which sees value creation and asks the question, at what cost? For example, can we hand on heart report on the success of patients treated, costs saved, jobs created, when achieving this success comes at the cost of the very environment that sustains us? The circular economy, it isn't the latest sustainability fad. And when done well, it's well beyond recycling. We are not talking about better waste management. We are talking about designing waste out of the system entirely. We are talking about changing the way we think about value when innovating new procedures, the way we communicate value to our communities, and the way we report value to our stakeholders. At the moment, in our current economy, we pretend waste is invisible, but the only place it's invisible is on our balance sheet, which in turn throws the system out of balance. Leaders need to take the time to work both in the system and on the system. Too often we can afford the time to go through our emails, but we can't afford the time to sit and think through big picture strategy. What we really can't afford is BAU. To create systems change, we must sound the alarm on business as usual.
So we need to gather data. We need to get a holistic view of the business, assess what materials go in and what goes out. This might sound like it is a complex way to start the process, but it's really about asking better questions. Systems change means making environmental health, safety, and sustainability key organizational priorities. A collective approach to education, goal setting, and accountability is needed to help bring everyone along on this journey. For example, some guiding questions that you might be able to ask yourself. Does your organization provide opportunities for educating staff and community on the relationship between public and environmental health? How can we help leaders empower their people with a big picture understanding of the material flows within their organization? And how can we help them identify the priority areas for change? Is there a potential to identify initiatives and set goals amongst different departments with visible reporting and mechanisms to share this with the whole of company? Is there an opportunity to draw from nature and bring the healing powers of the natural world into the healthcare environment to keep environmental goals front of mind? When it comes to leadership, storytelling is perhaps the most powerful catalyst for facilitating the transition to a circular economy. We often say shared understanding is the hidden metric that will scale shared value in a circular economy. What stories are you telling to connect public health to environmental health in your organization?
So the circular economy, it's actually as old as time, as wise as our biosystems, and as capable of solving our most wicked challenges as our own curiosity will allow. The circular economy is a practical systems approach to systemic problems, so long as we do the work of having the conversation and asking the questions. To take the words from recognised circular economy thought leader, Dame Ellen MacArthur, the circular economy isn't about one manufacturer changing one product. It's about all of the interconnected companies and governments that form our economy and our infrastructure coming together and rethinking the operating system itself.
So the world is ready for the next phase of a healthcare revolution. What would it take to transform your organisation from an outdated linear system of healthcare into a regenerative circular system that supports public and environmental health? In finishing with playfulness and curiosity at heart, we dare you to do 3 things following today's session. Think about your leadership and ponder what is one small choice you could make today that might catalyse big change tomorrow. Experiment with a circular mindset and ask at what cost? What is one invisible cost in your organisation that you could shed a light on? And lastly, what is the story you're going to tell yourself and others about the triangular connection between our own health, our healthcare system, and the health of our planet? Change the story to change the system. Thank you so much for your time.
Thank you.
Thanks.
Thanks very much. I think the first time I ever heard Janie and Ashley speak, I was totally inspired about what I could do both personally and as a system, and I still get inspired by you both. Thank you very much, and thank you very much for your time today. Next on the agenda, we're back online. Dr. Rose Cameron. Dr. Rose Cameron is an anaesthetist tech trainee at Auckland Hospital and a steering committee member of TRASH, the trainee-led research and audit in an anaesthetist for sustainability in healthcare. TRASH is an independent trainee-led Australasian group focused on stimulating positive culture change, sustainable practices in anaesthesia. TRASH overarching goals are to collaborate and innovate, find new solutions to waste production and management while upholding high standards of patient care. Rose is also a member of the New Zealand Society of Anaesthetists, Environmental and Sustainability Network, and sits on the ANZCA New Zealand Training Committee. Please welcome Dr. Rose Cameron. Thank you.
Good afternoon, everyone. My name is Rose Cameron. I'm an anaesthetic trainee working currently at Auckland Hospital in New Zealand. I'd just like to thank you for the opportunity to speak to you all today. I'm very excited to be part of this conference and leading from that previous talk. I think this talk fits quite well. TRASH stands for Trainee-Led Research and Audit in Anaesthesia for Sustainability in Healthcare, which was founded by 2 very inspiring co-leaders, Dr. Jess Davies and Sophia Grobler. So today I'll briefly touch on our projects. Healthcare is responsible for 7% of total carbon emissions in Australia, and we think reducing this is very important. So our projects focus on that. I'll explain what we've achieved so far and how they relate to some of the key themes of the conference, including sustainable waste management, improving climate resilience, and circular healthcare. So operating theatres produce around 20 to 30% of all hospital waste, with anaesthesia making up a quarter of this. We also use gases to anaesthetise patients that have large global warming potentials and carbon costs, with desflurane being one of the worst. A brief look at how much waste we produce from a paper published by WSEC and also another by Forbes and Again demonstrated that reducing and reusing are more important than recycling. As you can see, 60 to 75% of anaesthetic waste is recyclable. So what is TRASH? TRASH is a collaborative network created by trainees for trainees. Now that's junior doctors or anaesthetic trainees working in anaesthesia, aiming to stimulate positive culture change by education, eco-leadership, and audit feedback to the department. We believe, again, that small changes can make a big difference. We have over 240 trainees and junior doctors signed up to be Trashies. I'll share some of our projects with you. We also have a number of consultant anaesthetist mentors that are part of our group. So Operation Cleanup Day is our annual sustainability event designed to be a day of engagement and conversation about healthcare's energy footprint and waste production, and we hold it on Earth Day. We started off in 2020 with a reduced bluey use campaign. Blueys are incontinence pads used to wick away moisture from the skin. However, they're often used unnecessarily in theatre with more eco-friendly alternatives available. They take over 100 years to break down and are not recyclable. For Operation Cleanup Day, trainees collect observational data on either the items listed on your screen, which is what we use for Operation Cleanup 2021, or Bluey use. Use this alongside current evidence to educate colleagues in our departments, improve awareness, and implement change on the day to actioning these. Following the campaign, the number of Blueys per surgical encounter went from 37 to 34 for OCU 2020, and absolute Bluey procurement was reduced in all but one hospital. This year, Operation Cleanup 2021, we promoted a bigger bundle, which you could choose one or all of the alternatives. We looked at scope 3 items that had an impact on the environment with suitable alternatives. The top is refusing desflurane, the volatile anaesthetic. I'll talk about this more later. The next is reducing Bluey use. We carried that on to the next year. Reusing drug trays. So drug trays, we use a lot in anaesthesia to draw up our drugs, hold IV line, cannulation products. We included them because reusable drug trays have half the environmental footprint of a single-use plastic drug tray, even when the energy is derived from coal. The last is recycle paper and cardboard, or look into the local waste stream in your department. Recycling operating theatre waste can reduce the amount of waste generated by theatres by up to 60%. Recycling is really the final step if reducing or reusing items are not possible. We had 75 trainees sign up and 15 hospitals provide data to us this year, with 2021 data to come early next year. The next Operation Cleanup Day is April 22nd, so get involved if you can. As I mentioned earlier, desflurane is a volatile anaesthetic we use to maintain anaesthesia. So Ditch the Des campaign was born from Operation Cleanup Day. Hospital anaesthetic departments can take the Ditch the Des pledge, which we have on our trash website. This involves removing desflurane from the anaesthetic machine so it's not available to use, reducing procurement by 50% each year, and removing it from the formulary by 2025 so that it's not available to have. Hospitals in Australia and New Zealand have taken desflurane off its formulary already, with 2 that we know as a direct result from OCU Day. 6 have taken the Des-free pledge. So why is desflurane so bad? As I mentioned on the previous page, it's good care for the patient, for the planet, and also for the purse. So there's little clinical benefit from using desflurane. There's many other alternatives to maintain anaesthesia. It's much more expensive, has a large environmental harm. So desflurane's global warming potential in 100 years is 2,500 times that, the same mass of carbon dioxide. 892 kgs per bottle of desflurane compared to an alternative, which you can see there, which is intravenous anaesthesia called propofol, where 21 kgs of carbon dioxide equivalent. Trash also has a number of sustainability focused projects and audits for trainees to participate in the year. They can be found on our website, but I'll just go through a few now. We have audits focusing on, again, scope 3 emissions, which are most of the items we use day to day in theatre. For example, 2 of our current audits are looking at perioperative paracetamol, recording the amount of oral versus IV paracetamol and aiming to swap it to oral, so you don't need all the plastic tubing, glass IV paracetamol drug that we use, and if it's appropriate, give it orally for patients. Our new Sharp Spin audit has just launched, which is also a couple of presentations ago looking at Sharp Spins. So Sharp Spins collect needles and glass that we use in theatre, of the yellow waste bins that you can see. So Sharp bins are designed only for sharps, and they're expensive to remove and either end up incinerated or crushed and buried. So what happens is things that shouldn't be in there end up there, like gloves, paper towels. They have a much higher carbon footprint than recycling or general waste, and routinely, as I mentioned, recyclable items end up in these bins. Therefore, having only sharp objects in these bins is not only good for the environment, but also reduces the cost to the hospital. We're also working on an audit cookbook. So this is developed to give ideas for sustainability audits for trashies that they can do in their departments. For example, looking at nitric oxide anaesthetic use. We also recently held our first trash conference called TrashCon 21 in mid-November, where trainees can present their audits, share their ideas, and share stories of local sustainability projects to inspire others. In summary, Trash is a collaborative trainee-led group aiming to stimulate positive culture change by education, eco-leadership, and audit feedback loops. Currently, we focus on reducing theatre waste and its environmental impact using the aforementioned tools, run primarily by our trainees with consultant overview as well. Many thanks to the wonderful steering committee and my co-members and our co-leaders, Jess and Sophia. Please feel free to have a look at our website. You feel free to contact me or our admin at trash.org. So thank you so much for listening.
Great, thank you, Dr. Cameron, for your time this afternoon. I particularly like ditch the deads. I quite like that. I think we'll probably find somewhere to use that elsewhere. So thank you very much for your time today. Next, I would like to introduce someone who's in the room today, and that's Rachel Jackson and Dr. Nellie Dick, who hopefully will be online. Rachel Jackson is a clinical nurse in emergency at the Sunshine Coast University Hospital. She has 15 years working in emergency departments within Australia, UK, and as well as remote village in southern India. Rachel is passionate about sustainability, establishing an ED environmental team who have implemented a number of waste reduction strategies and procurement changes to contribute in a more sustainable practice within her department. Dr. Nellie Dick online with us is a specialist anaesthetist at the Sunshine Coast Hospital. I hate that word. Nellie's professional interests include environmental sustainability, pain management, welfare, and procedural care of orthopaedic patients. Nellie has been involved in environmental sustainability within the theatre environment since 2017, helped with the AWARE group, here we go again, anaesthetist, waste, recycling enthusiast. Nellie is also an active member of the Sunshine Coast University Hospital Health Service Environmental Sustainability Committee. So Rachel, I'd like to ask you to come up, and thank you very much. I'll hand it over to you.
Okay, fire away, Nellie.
Thank you, Rachel. Sorry I couldn't be there today, but I was on call until 7 this morning and I had a very busy night. So thank you for having me. Although at home I'm a passionate environmental enthusiast, my environmental enthusiasm being kindled by being brought up on a Sunshine Coast hippie commune, it didn't occur to me that I could have any real impact in my workspace until 2017, when we moved from Nambour into the $1.8 billion Sunshine Coast University Hospital, the largest public healthcare facility in Australia to achieve the highest honour of a 6-star Green Star design rating. Some of the features being solar hot water, LED car park lighting with electric charge stations, and rainwater. We also have solar panels in the pipeline, starting with our smaller Sunshine Coast facilities. Nestled between the ocean and the forest, it was in this setting that I joined the like-minded individuals in our anaesthetic department and operating suites to work out what we could do. And thank you, Ashley and Janie from Choreo. Small moments do lead to big movements. Next slide, please. As it turns out, we could begin commingled recycling immediately through our local council, who were very helpful with information, education, and resources. As represented in our waste and resource management hierarchy, the ultimate goals of an environmental enthusiast are to refuse, reuse, and recycle. This sparked a journey within our anaesthetic department, and the anaesthetic waste and recycling enthusiasts were born. We wanted our colleagues and the wider hospital to become aware. This movement grew, and the executive created a hospital-wide environmental sustainability committee, which now oversees all of the good work we are establishing in our hospital. As we can't refuse a good coffee, all anaesthetists know, we created a reusable mug that is accepted at all of our coffee vendors in our hospital. We engaged with Wishlist and Spotless in our hospital to purchase disposable coffee cup recycling receptacles for those that can't or forget to bring their own mug. Next slide, please. In theatres, through education and removal of desflurane, we have not only saved money, but reduced the global warming potential impact of our anaesthetic gases. And I'll have you know, Rose, that our department are planning on taking the pledge soon. We have projects going to ban the bluey and ban the booty. We encourage reusable hats for theatre. We recycle TEDs, Scuds, theatre caps, KimGuard, metal instruments for revenue, batteries, pens, and bottle caps. We have switched to using sugarcane trays instead of plastic that biodegrade, and we are sourcing other sustainable options for the plastic we currently use. Next slide, please. Dr. Stacey Swinkles, dedicated environmental sustainability lead, managed to engage with Fresenius to become the pilot site in our operating theatres for the first upcycling project for IV fluid bags and coverings. This is to mirror the Baxter PVC recycling program. This has since been rolled out to ICU and DEM and has been responsible for at least a tonne of waste diversion from landfill. Next slide, please. Currently, we have dedicated staff members who collect soft plastic to recycle through RedCycle at the local Coles and Woolies, along with lids, bungs, bits and bobs, and high-grade glass bottles awaiting a final destination, whether that be for the sake of art with our local artists or through a dedicated upcycling avenue that we are currently in the process of securing. And it's very exciting to learn more about circular economies, and hopefully we'll see more change in that regard soon. I'm very excited to be here today, and I'm so grateful to be able to say that the culture of sustainability is thriving in our award-winning hospital and health service, and it's driving the changes that are happening and the changes that are to come. Next slide, please. I'd just like to leave you with a quote from Jane Goodall. There are so many ways in which we are destroying the planet, and once we understand, once we care, then we have to do something. Thank you. I'd like to hand over to Rachel.
Thanks, Nellie. Over many years working in healthcare in Australia and abroad, increasingly I have noticed the amount of waste created in providing care for patients. I also accept that the pollution caused by the care we are providing is part of the problem of worsening health within our population, which we've identified today. I've had the opportunity to step into a role that incorporated looking after equipment within my department. This highlighted the volumes of consumables that we use and the amount of waste generated, but it also spurred an interest in thinking about solutions. With the supportive management team and other passionate staff wanting to make a difference to the way we deliver more sustainable healthcare, my journey into greening our emergency department began. Our presentation focuses on building a green culture, and I want to share with you some of the challenges and solutions we have faced in creating a shift change in the way we deliver more sustainable care to our patients. The challenges in each department are unique, and for one of us, the key issues is geography. I work in a very large department that is separated into various pods and with big distances between these pods. The pods are not all set up the same way, and there are also space limitations within these areas that create issues with how we manage our waste. We can't change the physical structure of the way our department is set out, but we have come up with some solutions to manage the large space we operate in. We're trialling some mobile recycling stands. The aim of these is to allow placement of recycling bins where they are most needed, making it convenient for staff. They also allow us to sort at the source, separating waste as soon as it has been used, which will hopefully enable a higher chance of recovering recyclable material. We have also created a sustainability tree. This was painted by a member of staff of ours, James Gormley, and is in a central location in our service corridor. The tree is very visual and creates conversations around sustainability. It also incorporates recycling bins for all of our waste streams, and this was inspired by how our theatres have set up their space to manage waste. Our aim is to create leaves from recycled objects within our department, and this will allow our tree to change and grow over time. Another challenge we face is the interest and engagement of staff to contribute to waste management. Working in such a busy, fast-paced and clinically complex environment creates challenges for how we engage staff with sustainable projects that invariably add a layer of complexity to their already busy working day. To engage staff, we have created an ED wellness garden. This space provides herbs, flowers, and in the future, fruit that staff can pick and take home or bring into the workplace. This aligns with our hospital's sustainability strategy and is also a positive way to engage staff in a more sustainable workplace. We also base a lot of our awareness activities around food. Healthcare workers have an innate ability to seek out food. I think it's probably been noticed today. And that once food is found and food is in hand, we then are provided with great opportunities to create conversations around sustainability. To date, we've held a Green Day fundraiser to raise funds for our mobile recycling stands, and we had an afternoon tea for the opening of our garden with some more activities planned in the future. Another issue with such a large department is the way in which we communicate. We have a large number of staff, so it's incredibly challenging to communicate effectively with such a large volume of people. We also have a range of specialty streams within ED to communicate with, and also a significant amount of transient staff. A constant change in people therefore requires a robust communication system. To solve this problem, we have looked at ways we can create a forum to communicate our recycling initiatives that can get disseminated to as many staff as possible. And we now have in place various communication tools, including Teams, the electronic platform that we're all very familiar with in our day and age. We have a thing called 5 Things to Know, where 5 key points are identified at each shift handover. The Edit, which is our emergency department environment team newsletter that we do quarterly. Scoop, which is a hospital-wide and HHS-wide newsletter, which creates a wider interest and provides inspiration for other areas to engage in sustainable projects. We have our beautiful designed environment sustainability shirts that Nellie was wearing and Chris is wearing today, created by Emma Nally, as well as sustainability forums held within the hospital. It is important to build resilience and continuity into recycling and waste management programs, and it takes a community to make these changes sustainable and to build an ongoing green culture. Our hospital and HHS have created an environment sustainability strategy, and it focuses on what can I do, recognising that each individual person has a part to play. This therefore builds a culture from the top down, setting out a strategy and action plans that we are accountable to achieve, and also from the grassroots up to enable each person to play their part in our green culture and our future. Thank you.
Great, thank you, Rachel and Nellie, for your time today. I think we forget that we can do small things within our own environment, and I think you guys have shown exactly what that can yield when you come together as a team. So thank you very much. Next on the agenda this afternoon is we're back online, and someone who I have been working with very closely for over the last 18 months, and it's Renee McBrien. Renee is a community horticultural and environmental consultant for Children's Health Queensland. She also works as a radiographer with over 22 years of clinical health experience. Renee has worked across many Brisbane hospitals to develop innovative ways to design out waste out of health. Her work includes horticultural therapy. She has established 16 community gardens across Brisbane and developed Allied Health Sprouts program, a referral-based horticultural therapy program that allows young people access to the rhythm and cycles of nature while in the hospital. Rachel's work was recently featured on the ABC War on Waste and capturing over 4 million views worldwide. So I'd like to hand over to you, Renee. Thank you very much.
Thank you, guys. Can you hear me okay? I hope so. It's such a privilege to be with you all today. I'm going to action pack this next 9 minutes and really unpack a lot. And I want this presentation to be very visual because what I'm trying to achieve is that you can see yourself in what I'm about to show you. So that solution doesn't seem untouchable. The solution is something to wake up to and have that bright sense of the future is full of hope. So I'm just trying to move my screen. 1 second. Just not being able, there we go. So we had the choreo, the two lovely sisters from Choreo speak before about designing waste out. And I've had the privilege of being mesmerized by their wisdom and direction before. So I'm going to speak to how exactly do we design that waste out of health. And I won't be talking about the rubbish in specific when I talk to waste. Waste is often profiled in health with a lot of things like what are we using when we don't need to use them? What are we buying and where did we buy it from? Was there wasteful carbon emissions in that transport with those purchases? So how we design waste out of health is really strategic, and we've got to really think about it from the top down. So to reduce our procurement, to source those sustainable products, develop product stewardship. Let's look at our waste medical partnerships outside of health, and let's work together to understand how we can further better recycling of our products. Let's revert back to reusable products. Let's be brave about that. Let's remove single-use plastic. Let's get it out of here. But most importantly, let's create the incentives that evoke the natural behavioural change to make this happen. Because one person in a hospital can't make this happen. It has to be everyone's fingerprints all over this, and we make a difference together. And we also really, at the end of this, we have to integrate that the carbon reduction into our economy. We have to make it worth something financially so that we get that buy-in as well. So at Children's Health Queensland, when I arrived, the first thing we did was actually think about this strategically and develop a plan. So this plan we've developed is over the next 5 years and has a huge action target of what we're trying to achieve. But this is the actual physical plan that you see. And it's really, this page in particular resonates with me because you're looking at the CEO, the Director of Allied Health, and our senior clinicians of anaesthesia in this image. So we have that executive buy-in from the top down just within this plan itself. But the plan itself is more like a magazine, so that when you turn it, it's a page turner and you can see yourself in it, your staff in it, and you can see what you can do to make a difference. So let's get IRL. So let's do this in real life. Let's look at some examples of how you can actually design waste out of health. I'm going to now fly through a few initiatives that we've actually managed to achieve in the last 18 months at Children's Health Queensland. So the first thing we did is become foam free in QLD. We have a pesky little styrofoam cups in our hospitals, and they're not good for the environment or public health. So we developed a business case plan to the executive where they made the investment to remove it from our procurement patterns. We have no longer got the styrofoam cup on any ordering system, and we've replaced it with a BioPack cup, which is compostable. We've also been able to buy the first hydrogen-powered car in Queensland Health, and we actually have also developed an e-garage to support staff travel to work. And I'm telling you, it wasn't expensive. It was a couple of scooter racks and PowerPoints, but it's been a game changer with our staff community of travel. It's been amazing. Things that we use in hospitals when we don't often need to use them, that waste in procurement. Particularly in children's, we have wraparound pulse oximeters rather than the crocodile clip ones that you can get in adults. And they're quite expensive. They're $18.40 each. So to try and reduce that culture of reaching for one of those when it wasn't clinically appropriate, I started a competition because everyone in health loves a competition. So I started with a target 10, let's get it down by 10%, and kept coming back to team huddles and engaging staff. And by the end of 1 month, we didn't smash the target by 10%, it went to 50% reduction in procurement. And that's a projected saving of $330,000 in a year. So that's when you're grabbing environmental sustainability with financial sustainability, and everyone kicks a goal. We also look at what we use and how we use it, what's wasted in what we're using clinically every day. And single-use plastic is one of those things that just keeps turning up in our bins and up in our budget as well. So we're actually converting back to greenware, reusable plastics. And we have 2 wards now that do not have single-use plastic, and our emergency is coming online with greenware in 2022, which is really great. Speaking to what Hugo was speaking about before, the new advanced recycling, we grabbed that at CHQ and we decided to run with it and really put it into practice. So this is now a new recycling that will capture our soft plastic, our LDPE, our KimGuard, and our polystyrofoam. So this is how it's got to be packaged and handled correctly for Cleanaway to be able to on-source that product. So actually what we have done with those bins, they've been in place for about 2 months, but they have filled up so quickly that we used to have every second day service. We've actually had to go with everyday service. And the answer is because we have so much soft plastic, and it's not just coming out of shrink pallet wrap, it's actually coming out of our clinical wards. They're taking away that soft plastic, bagging it appropriately and getting it into those advanced recycling bins. We worked very closely as a theatre team because there is so much plastics, as we've seen in all of our presentations today, on how to reduce it. How do we look at our plastics and actually look at the volumes of what we're doing, because it's so clean and it's so great for the recycling industry. There's no yogurt on it from like your recycling bins have at home. But what's really important about our plastics in hospitals, it's not often known what they are on that plastics numbers 1 to 7. And what you're seeing on the screen here is something really quite unique, and I'm really interested in, and in moving into this in an advanced way, is when somebody brings us a medical product into the hospital, they give us this information. They've outlined, for example, this is a breast pump, and it has gone through every component of the breast pump. So I know exactly what parts they are made out of what plastic. So then I can take that information from my medical partner to my waste vendor, and we can collaborate correctly to recycle these products. And that's where the future is bright, I believe. What we've also done at CHQ is look at metal recycling, and just look at that, the vast impact it has on our environment when you're mining through the earth to pull these minerals out of the earth. We need to respect these. So we've introduced these new multi-gate bins in partnership. They're an upcycled bin that collects mostly out of our theatres and clinical areas. So what we grab is clean diathermy wires, laryngoscope blades, single-use scissors, forceps, even ECG dots, and it can take medical waste as well, e-waste I should say. And this is what it looks like. So we get about 1.5 tonnes a month of medical and clinical metal, and we rebate it. So we sell it to a local Brisbane recycler for about $500 a month. So we're no longer paying for that waste. We're respecting the recovery of the waste, and we also have got a rebate consolidated revenue from there. We've also developed really important strategic partnerships in the community, like with our e-waste. We no longer send that to commercial spaces. We're sending it through to Substation 33, which is a social enterprise located in Brisbane, which re-employs Queensland youth into refixing that e-waste and upcycling it, which has been really important. Well, let's talk about some of the things like end-of-life assets, but they still have life. And how do we deal with all of that? But here in Queensland, we have an amazing system. We have a health technologies website. So this is an avenue where we can take, traditionally it was health equipment, and we could sell it on a website to external partners. But what we've done with the help of Simone Ryder, who's our facilitator today, is actually take it out of just medical waste, and let's look at everything we can actually keep reusing. So we actually have started to sell our onset of lots of assets, consumables, and we've actually in the last since July the 1st, made $160,000 and sold 1,212 items. So it's a huge amount of volume that's being partnered and reused in our hospital communities outside of health. What we do with our assets and consumables that we can't sell through that avenue is we've actually developed a partnership with Rotary Donations in Kind. We take these assets that are related to health and education and divert them into international aid, which has been really important, and we send that off once a month. I've also been out in the community and found partnerships with people like Reverse Garbage, who can take those odds and sods and bits and bobs that we have collectibles like the tips of catheters and tops of antibiotic vials and reuse them through Reverse Garbage as well. We also look at things like our packaging solutions, which are really important, looking at our packaging and how we can reuse those through Reverse Garbage. But also, as you can see there, just on that slide there, that's the new thermal packaging product that's coming through, which is actually made out of wool that is no longer viable on the wool industry market. So if a sheep has, for example, there you're seeing one that looks a bit like a Dalmatian, has some black through the wool, it's actually deemed not valuable on the wool industry. However, it actually has got a lot of worth when we can use that for thermal packaging. And actually through that process, we can support the wool industry and remove styrofoam out of our packaging industry, which is really important. Small other things we do is we grab our unused syringes and we put them through to Rescue Collective. We make sure no food is wasted on site. We rescue that into food recycling, and Oz Harvest comes to get our non-perishable food from non-infectious patients twice a week. So how does all that get achieved in such a short amount of time? And the answer literally is the socialization of sustainability. We have to get this sustainability out and about in our hospitals, so it is our brand and it is our commitment as staff inside our hospital. So we have a green team of 110 members that meet once a month, and we have an environmental hub, this central communication that's been working across our hospital. We also have community gardens in our hospital, just like Sunshine Coast, that allows staff to engage in these outdoor hubs and respect and connect with the environment. As we were saying before, we run a horticultural therapy program. We have staff worm workshops and worm farms that are strategically allocated so staff can actually also be involved in that process. So to engage staff in there, we've actually created a Community Garden Member of the Month award. And we also do a lot of freebies and action on the side where we give away free coffee grinds, free moving boxes, and actually socialize our environmental aspects in the hospital foyer. So we'll grab our staff, and we have the luxury of having an indoor TV program where we actually make TV shows for the kids. So what we do in the foyer is then push back up into the entertainment unit. So we're actually teaching the next generation about our sustainability and health. So to actually build a brand and recognition around this, we have an internal environmental stewardship award, and you're looking at it there. It's made out of Australian recycled timber and Australian recycled hospital steel. And it's an award we give out through our environmental stewardship network each month that celebrates our staff, and it's put up in our internal screens. So it's always in everyone's vision and everyone's culture to respect the sustainability of our hospital and to be a part of that green team. So thank you very much for having me, and I wish you all the best for the afternoon. Thank you.
Thanks, Renee. Yeah, your enthusiasm and your energy is always amazing, and what you can achieve only part-time at Children's as well. So well done, it's awesome. And 34th recycling stream, did I read that correct?
Yes, no, we don't. I think we went to 35 the other day as well, and counting, Simone, because the little things do matter.
Great. No, impressive. All right, well, we're up to the panel part of the session today. So I'd just like to invite the speakers who are still in the room, Rachel, Ashley, join me up front. We've still got everybody online that survived. My first question is to Stephanie. Are you aware of health organisations in Australia who've made good progress in providing sustainable food? What changes led to the most emissions reduction?
Yeah, I think this work is becoming more predominant in hospitals in Australia, especially in terms of like different strategies. More hospitals are investing in food waste digesters, reusing, and also looking at changing their food service model. So a great example is the Mater Hospital. They were one of the first hospitals to change to the room service model, and that has been able to improve patient satisfaction and reduce food waste. And they worked with a chef as well to on their menu. So that's an example. I know Queanbeyan Hospital in New South Wales, they send their unopened packaged food items to OzHarvest, and then they redistribute those items to, I think, schools. So yes, more and more work is popping up across hospitals in Australia.
I've got a question for Hugo for Cleanaway. How can we improve resource recovery in regional areas? We have few options in Victoria for recycling, or they're not financially viable compared to Metro. Dropped out, lost him, no worries. All right, we'll come back to that that question, we'll come back to the line. All right, for someone in the room, Ashley, how much is the linear economy driven by industry? How can this influence be countered?
Right now, where industry is incentivized to make things to break, because that facilitates us to buy more product. And I think it's about having conversations with supply chain, but governments are also involved with that as some of the biggest procuring organisations in our economy. So it's both private and public industry that have to step up, and all of us to also have bigger conversation about what we can do and be aware of how much we are consuming. If something is breaking faster than it should, and that's most products, our laptops, our phones, we need to be asking for better products. We need to be fighting for right to repair policies as well, because we don't really have repair solutions in our market right now either.
Yeah, it's tough.
It is tough.
Yeah, it's tough. Rachel and Nellie, I've got a question for you. Are there plans to change from single use and recycling to reusable options at the Sunshine Coast University Hospital?
Yes, I think there is a plan in place to do that. I think for ED, we do use video guided laryngoscopes, so all reusable, so they go through CSSD. We are trying to reduce as much as possible some of the single use, and we are moving a lot more to the sugarcane biodegradable options where we can. quite a lengthy process to get that in place, unfortunately. But yeah, there is a move to sort of work towards that.
Yeah, great. So I think that's something we forget is that supply chain does take a bit of time, but it's worth it to stay determined on that pathway. So that's great news. I've got a question for Dr. Cameron online. Can your resources be used by people in other professions as well?
Yes, definitely. We're trying to increase our scope at the moment. So we just started off in anaesthetic trainees, and we're trying to collaborate with other areas just within the hospital now, but definitely feel free to contact us or myself, and we can discuss. I think most of our kind of priorities for trash can be used in other sectors, not just healthcare or in the hospitals.
Okay, great, thank you. And it was the trash website, isn't it, that they can go to collect that information? Yes, and also, if my slides are available, just my email, and also admin@trash.org. Great, thank you. I have got a question for Renee. Some of us find the bureaucracy gets in the way. Do you still get pushback, and how do you overcome this?
I guess that's a common question you often get when you're starting off, but I think the answer to that is resilience, commitment, and a little word called trial. If you don't come in guns blazing and you do a little background research about what you're trying to achieve, put it through together with some solid paperwork. And I think the answer is to gather that green team momentum. I'm lucky enough and fortunate enough to have that executive support. So I've already got that escalated governance above me. But when you don't have that, I think the answer is to gather the green team, to gather that momentum, and to make a little voice, but also to put forward a trial, I think is the answer, to try and sort of filter through a bit of the bureaucracy to get some runs on the board. I think you just need to get little achievements, particularly if you can balance it with financial sustainability. If you can make something resonate financially as well as environmentally, people's ears start listening to you a lot quicker, I tell you.
Yeah, no, I agree. If you can definitely find those financial savings, it's a little bit easier, that discussion. Next question, another one for Rachel and Nellie, I should say. How are you recycling the glass with medical residue?
A big one for Nellie, I think. Hello. Glass that we have in theatre at the moment is not actually recyclable. We are yet to find a circular economy solution for the glass bottles. They're made of a really high grade glass, much like Pyrex, so it can't be put into commingled recycling to become a new glass bottle, because it actually creates faults in the recycled glass when it's put with other things like jam jars and beer bottles. So if anyone has a solution for that, it would be wonderful. The drug residue at the moment, because I do collect all these glass bottles for hopefully an art project that is coming up, but we just empty them into the sharps receptacle, but there is still a little bit of residue there that we don't really have a solution for at the moment.
Okay, no, thank you. It's something that we can probably maybe help out a bit there as well through the Office of Hospital Sustainability. Angela, last question. How are environmental impacts measured? Do they take in measures such as water degradation, as in the Murray-Darling with almond farming and others?
Thanks for that question. It depends on the research project that you are, or the study that you're looking at. Some of the newer research has looked at all the inputs that go into food production, so it takes into account water use. Having said that, though, you would need a specific Australian-based context study, which would also take into account downstream influences of using that water and what the environmental impact of taking some of that water away from other projects would be. So no, some of the international research has just used water use and land use, and then the emissions at the other end. So it really does depend on the modelling that's used for the individual studies.
Okay, great, thank you. I think that's the end of this session. Oh, we got one more. Oh, okay. What question? Okay, I've got one here. Is organic food sustainable? It's a good question, really, when you think about it. most people assume it would be. I'll hand it over to Angela or Stephanie if you've got the ability to answer that question.
For the organic food, I'd say possibly not. It depends on the way that it's produced. Your yields are going to be quite low. The land use is going to be quite high. Yeah, it really would depend on the individual producer, but some of the benefits of safe pesticide use and so on is that we can produce a whole lot more food and we can do it in a very sustainable way. So organic's not necessarily a better way to go.
Okay, great. Thank you for that. We're right now. One more question. Oh, go on, one more question. Okay. What have we got here? There's so many good ones. Apologies, we won't get to all of them. What have we got here? Gosh, shouldn't have left me in charge of this. Renee, is there much info about the resources it takes to clean up reusable equipment?
That is true, because you do need to have some, for example, in CSU, when you're sterilising to reuse, you use a high energy output and water. We've actually done an audit of our sterilising unit and actually purchased some new trays that I think the water reduction was 80% per clean. So we have to counter that in. The data I don't have to represent, but I do keep an eye on those sorts of things, because you can't just say reusable is better when you do use high energy outputs of water and energy to re-clean. So in particular with sterilisation of reunits, we've taken a step into that, made an investment to have water saving facilities in our CSU. And just with wiping out the greenware with a detergent or universal wipe, it's by far cheaper on the environment to do that than actually build a petroleum-based single-use plastic and then put that back into a recycling stream. So I think we do need to value that input and investigate that data in the terms of what is the carbon emissions with those.
Yeah, no, true. One question to you, Ashley, I think, is how does someone get started on that circular economy journey? What's the low-hanging fruit where you can, start participating in that or getting your health service or hospital across that line?
I think we've heard so many brilliant initiatives that are a starting point. To be honest, the starting point is often waste, because it can be one of the most visible things we interact with in a day, disposing of items that are in any of your practices for the people in here. So waste is the starting point, but the conversation should not only be looking downstream at our solution providers, like our recycling companies, reuse solutions, but also in the upstream, the procurement, the executive team internally. How do we get to start thinking differently about what we are consuming, why we are consuming it, and the net impact of that? And we have to actually measure that. It's not just about carbon, it's such a bigger picture, but it does start with the things that you can control today and those that you can influence tomorrow.
Yeah, thank you. Great. All right. Thank you very much. I've definitely given the call. We can wrap up now. I don't want to hold you back from afternoon tea. So I just wanted to thank everybody who's been available for us today and online. I think there's been a lot of thought-provoking ideas where we might be able to go to next for a lot of people who participated here in the room and online. So I thank you very much for your generosity today. Thank you. Thank you.